Hi, my name is Michelle Hawks, and the career that I researched is a child life specialist. For my example organization, I used Children's Hospital Los Angeles, and for career contact, I don't really know anyone in this career, so I wasn't able to interview anybody. But throughout my research, I found out that for the working environment, you're most likely to be in a hospital. Um, if you're just starting this career, you may have to work off-hour shifts or relocate to get an entry-level position. Child life specialists, like I said, work in the hospital. You're most likely going to, well, you're going to be working with children. However, more professionals are expanding into different environments. So you could work in an outpatient healthcare facility, in a hospice, specialized camps, doctor's offices, court systems, schools, and funeral homes. And these are just some examples, and there could be more environments that you work in. Um, as far as much as the awareness of this profession is growing, there will be a greater demand for it. So that's also why it's a competitive field to get into. So typical stressors of this profession, because you work in a hospital setting and you're working with children who have medical issues, you need to be emotionally prepared to realize that some of your children you're working with may not survive their condition. Also, with typical benefits, there are many possible with this profession, including annual bonuses, flexible spending plans, employers contributing to your retirement plan, dental, vision care, group life insurance, health club memberships, disability cares, and tuition reimbursement. And these are just some of the typical benefits that could be expected of this position. So your common job tasks as a child life specialist would be to provide emotional support for children who are facing challenges, and these can be healthcare issues, hospitalization, things of that nature. You're also to provide information, support, and guidance to parents and family members of these children, because it's a hard time for them as well as the children themselves. Also, you're responsible for educating others, including the children's caregivers, administrators, and the general public, so they're aware of what the child is going through. I found a list of specific tasks from the Child Life Council, and there's a lot of them, so I'll just read a few. But they include non-medical preparation for tests, surgeries, and other medical procedures, support during these medical procedures, sibling support, support for grief and bereavement issues, outpatient consultation with families, collaboration with various pediatric therapies, orientation, training, and supervision of volunteers, including pet therapy programs, and education for the community on the needs of children and their families. So to get into this field for educational requirements, the minimum that is required of you is a bachelor's degree. It can be in any field. It doesn't have to be in a child life major or something of that nature, but it can be in any subject. But along with the bachelor's degree, you need to complete a child life internship and then pass the child life professional certification examination. And if you're in this field, your starting salary is about $35,000, and an experienced salary range is about $58,000. So your average would be $46,000. And there are other positions in this field. You could be a manager, have some kind of leadership position, but these are just average numbers for a child life specialist. So just some things to know about this career. You need to be flexible, patient, and innovative. So flexible, you need to be able to be there when the child needs you. Be patient, because sometimes you're working with children who have a medical condition where that they might not know what is wrong, and so you need to be patient as you work with the families and understand what they're going through, and find out different ways that you can help that child, uplift them, make them feel happy as they're going through this. And then also you can volunteer to work with children who need special health and who have these kinds of needs, because it builds your resume and will prepare you for this profession better than any research or reading about it could, because you'll actually have that firsthand experience. So I got this information from the NCFR booklet, the Careers in Family Science pamphlet, and also from the Child Life Council, and their website is childlife.org. And thanks for watching.